Hi, everyone. I'm Yona Lunsky, and I direct the Healthcare Access Research and Developmental Disabilities Program here at CAMH, as well as the Azrieli Adult Neurodevelopmental Center. And we've been doing a lot of work since COVID started, engaging with not only people with disabilities, but many families. And so today we're going to answer some of the questions that those families have right now as we've entered our second COVID wave here in Canada. And I'm joined by Dr. Niel, who's going to introduce herself.
So hi, I'm Dr. Niel. I'm a family doctor. I work at Scarborough Centre for Healthy Communities, which is a community health centre in Toronto, Ontario. And I have quite a few patients with intellectual disability in my practice. I also work at Participation House in Markham, which is a group home for adults with intellectual disabilities and cerebral palsy.
Welcome. And I'll tell you why we're having this conversation with you. We're so excited to be able to talk with you a bit. We've been meeting with a number of families virtually from across Canada, talking about COVID-related issues over the last 6 weeks or so. And there's a lot of questions that come up, even though COVID's been with us for a long time. I think families still have questions. And what I've heard is that sometimes the general stuff on the websites is helpful, but they really wanted to hear from someone who works with people with developmental disabilities, particularly adults with developmental disabilities, because sometimes the issues are a bit different, or they need additional supports, but they're not in a children's setting, and they have adult issues to think about. And so we thought, well, let's see if we could just talk with someone who works a lot with this population to maybe just answer some of those sort of more general questions that people have. So if you're okay, I'm just going to jump in and ask you some questions, okay?
Okay, let's do it.
All righty. So the first set of questions people are asking were really sort of just like a recheck on the symptoms of COVID, because as you know, someone might have COVID, someone might have a cold or the flu or something. And how do you know which is which? And how can you tell if it's COVID and not maybe just a cold?
So that's just one of the biggest problems about COVID is that it does overlap with other viral illnesses. So it can look like a cold or the flu. The primary symptoms that we look for are fever, cough, shortness of breath, and there is one unique symptom, which is loss of sense of smell and a loss of taste or a change in a sense of taste. But aside from that, people have also commonly reported things like diarrhea, nausea and vomiting, stomach pains, and it's just not very specific. You can have a runny nose. It does look like a cold sometimes.
So when do you decide to get tested? What do you do?
So if you have one of those symptoms, it does warrant a test. And if you're not sure what to do, I think the first thing you should do is call your family doctor's office, ask them, tell them about the symptoms and ask what they suggest.
And do you find is that okay just to call even if you're not going in? Because I think some families are scared to go in for a visit if they don't have to, right?
I think a lot of family doctors, well, most family doctors' offices have completely adapted. So, for example, at my office, we do telephone appointments regularly, and we also have video conference appointments available. So things may have changed at your doctor's office in the past few months, and it's important to give them a call and see what they say. They might not make you come in.
Great, thanks. So I think we get through that first part, which is, should we get tested? Start with the doctor, and they can help make some of those decisions, I think, around where to go or what to do. But there's also a question, I think, around some people are scared that the testing can be kind of invasive, right? So, and people in the testing centers may not know, people with developmental disabilities, what happens if it's really hard for them. So I think families are really afraid of that. So what would you tell families?
So the best test is the nasopharyngeal swab, which is sometimes they call it the NP swab. That test sometimes feels uncomfortable. It's like a long Q-tip on a flexible, flexible cotton swab that goes in the nose. And it feels sort of like when you get water up your nose, but it doesn't last for very long. I had concerns about some of my patients getting that test done And I performed the test on quite a few people, and I found that I was surprised to find that some people who I thought really wouldn't tolerate it were just fine. And other people didn't even really react at all. So I think it's you don't know exactly how it's going to go. It's a good discussion to have with the testing center. So if you are going to go for a test, you can try calling ahead and see if someone can talk to you about what tests they have available there. That NP swab is the best test because it comes back the quickest and is the most sensitive. So it will pick up whether you have coronavirus or not better than other tests. The next best test is a swab that just goes in the front of the nose or in the nose and throat. And those are also available in some areas. And there is a saliva test that is available in some areas as well. The saliva test takes longer and it's not as sensitive. So it might say that you don't have COVID-19 when you do. So you have to kind of weigh the pros and cons. When you go for the saliva test, I've heard lots of people say, I wanted to try that one because I really didn't want to do the swab thing, but then they spend a long time at that testing center trying to get the volume of saliva that's required for the test. So there's that, and then and then they have to wait a longer time to get the test results back. So you have to kind of talk to the testing center and see what they say.
Right. I mean, I guess it's, one important thing we know now that maybe we didn't know when this was happening in the spring is you've seen a lot of patients now who've been tested with developmental disabilities. And I'm guessing at the testing centers, they've seen a lot of people as well. So they're probably getting a bit more flexible, sometimes a bit more adaptive for different people. And like you say, some people you think would have a hard time, maybe it's not quite as hard as you think, but certainly I'm hearing from you, talk about it, talk to your doctor, do some problem solving.
Right, and ask the questions, because also not all of the sites have all of the tests available, right? So you might get somewhere and then they just have the NP swab, so you have to ask.
Okay, that's really helpful. I have some more questions, I think, around the testing, or actually really about COVID itself. So you told us about the symptoms of COVID, but there's people who talked about sort of long haulers, or like the symptoms that might last a long time, or like how long COVID really lasts for people. How severe is it for people with developmental disabilities?
Right. Well, there have been reports of these folks who kind of have these kind of long-term symptoms of shortness of breath, cough, maybe fatigue. Some people have a problem with their feet or their toes, they feel cold. And we don't know that much about why some people have that versus others. And personally, I actually don't know if it's more common in people with intellectual disabilities. I would say, just by looking at the people in my practice, that I haven't noticed it to be specifically more common in one group or another, but I think we'll find out as more research comes up.
Right. So yeah, remembering, I was thinking, even when you were talking about, the taste and smell, like how do we ask that of someone with how do we ask about long-term effects of COVID symptoms in someone who maybe isn't the best talker about their symptoms over time, right? So some things we can measure and observe or see, and then other things we have to kind of ask people's opinion about it, which I think would be hard.
But at the same time, you can kind of use some of the clues that you use day to day anyway with folks with intellectual disabilities. So noticing that they just, maybe not seem to have less appetite or less interest in food, or there might be some clues that the sense of taste and smell is still altered.
So I think some families are very afraid, especially, from different news stories and things that they've heard about the really severe effects of COVID that could impact their loved ones. I wonder if you could talk about how COVID impacts people with developmental disabilities and sort of what to worry about.
So I think, well, in most cases, people have a mild illness, similar to a normal cold or a flu. But there are those rare cases where people become very sick and end up in hospital or need support in the ICU. There is some research on intellectual disability, none specifically in Canada, I don't think, but Yona, I think you could comment a little bit about the research.
Sure. I mean, I have to agree with you. We do not have numbers yet in Canada. And I think, I think that's a problem because it also relates to, the advocacy and the information campaigns that we're doing, right? But there are studies that have been done in some other countries. And I think certainly, one important finding is that we know that COVID's worse for people, when they're much older. And I think for people with developmental disabilities, people who have very severe morbidity or get hospitalized, and also people who die with COVID aren't necessarily quite as old as the people that we hear about in the general population. So kind of at a younger age, you might be more vulnerable. So maybe in your 50s, or even for people with Down syndrome in their 40s, that they're more like an adult who would be in their 70s or 80s if they have COVID in terms of how they would respond. So some people are more vulnerable that way. But one thing I think about when I look at some of that research is that we can only study things that have happened already. And part of, I think, what makes people sick isn't just kind of what's going on in their bodies, but also what's going on in their environments, right? So when people were getting COVID, when a lot of these studies were done, we didn't necessarily close certain programs. We didn't necessarily have PPE for staff to wear. People were, going to different places and also not picking up those early symptoms and helping people early. So I think that, certainly maybe the way I think about it, and you could talk about it as a doctor, but I wonder if some of the vulnerability we have to remember isn't just about the disability itself, but it has to do with our response to people with disabilities. And we're studying things that happened in that first wave in certain countries. So I think we have to look at what happens right now, and what we're doing and how responsive we are.
Right, yeah. And I think national data is going to be really helpful for Canada, but we have to also think about how things have been changing differently in different areas of Canada, right? So it'll be interesting to see what comes out of that research.
Yeah, I mean, certainly what I'm hearing from you, though, is the importance of checking things out with your doctor early, right? Because we don't always know that it's COVID and we don't know how severe it's going to get, right? So we want to look to you to help us.
Oh, that's another thing. I do have some patients, they go and get the swab and then they're advised that they're positive, but they don't contact our office. So I always reach out, but I think it is a good thing to connect with your family doctor's office if you get a positive swab, just so that they can give you some advice, what things to look for, watch for, and so you understand if things are progressing in a direction that needs to go to the hospital.
Right. Yeah, and I guess again, it kind of depends what's going on in the hospitals. There's certainly very stressful times right now for some hospitals in some regions in Canada, but it still can be really important for somebody to be seen, right? I guess the other thing is that sometimes someone can get worse quickly, would you say?
Yes, absolutely. And so if you understand the signs, it's important to know. One of the most common things is just respiratory, right? So lung problems. So if it's looking like breathing is becoming really difficult, then that might be a sign that it's time to go to the hospital. But you can always call your family doctor to ask for some advice.
Some people are really scared about hospitals because, and there have been stories about this in the paper and that kind of thing, about rules saying that you can't come into the hospital if you're a family caregiver. So I wonder if you have any thoughts or advice on that.
I think that's something that we can always try to work on being prepared for, right? So there are a couple tools that are available. There's a tool that can help you. You can fill it out and it gives information about your loved one called I'm forgetting the name of the tool.
I think it's the hospital
transfer tool. That's right. So the hospital transfer tool, but it's really useful because not only does it give information to help the people who are providing care in the hospital, but it also gives them a little glimpse into what it's like taking care of your loved one, and they might understand better why a support person would need to come in too. So there's that. And then, I mean, even if you don't have that or you don't have the tool available, having a letter from your family doctor or someone who knows them well explaining medically why it would be a good idea to have a support person with them is also helpful in some cases.
But what if, like, you can't get your doctor to write that letter and you're going to the hospital? Is this something you can talk about early on? Like, have you made letters for people that aren't going to the hospital right away?
I've been giving out that transfer tool like crazy. So most of my patients have had it for since the first wave. And luckily, a few of my patients in my outpatient practice have had to go to the hospital, but I just want everyone to have it ready. Just in case. And we're talking about COVID-19 today, but there are lots of reasons that you have to go to the hospital. And so having the form ready and available might be important, especially if the hospital's under stress and they're still having rules and things like that about caregivers.
Very helpful. Okay, so we've talked about COVID, we've talked about screening for it, we've talked about what happens when you have it, going to the hospital. What about all the things we're supposed to be doing still to prevent it? Is it still the same rules we heard about in the spring? I wonder, can you talk about the most important things we should be doing?
So each region is going to have different specific rules depending on the prevalence or how much COVID-19 is in your community. But in general, everyone should be performing good hand hygiene. So washing your hands, making sure you get under the nails and behind on the backs of the hands. So doing that regularly. If you're going to use hand sanitizer, it has to have more than 60% alcohol content. And wearing masks. So if you're out in public, it's a good idea to wear a mask, especially if you're going to be out indoors, or if you're going to be outside and less than 2 meters apart from other people. And I find for a lot of my patients with intellectual disability, it's kind of hard to explain the exact distance that you need to stay apart from people. So if possible, wearing a mask most of the time when outside of the home is a good idea. And then, so we talked about 2 meters apart. So that's physical distancing, which we've all heard about and know a lot about now. But it is actually really important because it can prevent you from encountering some of the droplets that come out of people's mouths when they're talking. So even if someone doesn't have a mask, it helps if you're apart. And also just avoiding crowds, right? So trying to stay home as much as possible. If your workplace allows options to stay home, to work from home, and avoiding crowded spaces in general.
Right. So, I mean, do you think it's reasonable then? Like, if I had a son or a daughter with a developmental disability or my sibling, to be out outside not wearing a mask, or do you think that really just put the mask on?
If you can manage, just wear the mask, right? But it's worth a try. See if you can work with the mask, and if it's really just a hard no from your loved one and they don't want to wear a mask and they can't manage, then what can you do? You have to just try your best to make sure that everyone around them has masks on. The other little tip that I have is that sometimes masks can be irritating behind the ears. So they have those headbands with the buttons that you can attach the mask to the button instead. And some people like that better. I've had people ask me, does it matter if it's a cloth mask versus like those medical masks? I don't think so. I don't think it really matters. It depends on the person, although some people say it's a little bit easier to breathe through the medical mask compared to a cloth mask.
Right. But then there's that smell. Sometimes some people might not like the smell of the. So I think I agree it's really individual, but practice. You know, I think one of the challenges.
Depends on the person, right? Yeah.
I was going to say, you know, if people are staying mostly indoors and not wearing masks, they're not really getting practice wearing masks. So then when they have to go to the doctors or they are going somewhere in the community, you don't know which mask works. You don't. So I think that practicing is really important. Even knowing, like, you might have a mask and it doesn't stay up properly, but you don't know that in the first 30 seconds, right? But you do know it if you keep it on for 5 minutes. So having kind of a mask test and seeing how it goes, I think is helpful.
Yeah, because it really does need to cover your nose and go under the chin, right, to be effective.
Yeah, I know I've seen and I've heard too, a lot of people who maybe were having a hard time with masks in the spring are getting more used to it with practice and figuring out kind of the right mask for them. Some people are worried, I think, what happens if someone in the household is still going to work out of the house? What kind of risk is that? Is that giving to the person with a developmental disability in the house? Does it mean everyone's at a higher risk for COVID or just the person who's working outside of the home? What do you tell families when they ask about those kinds of decisions?
Well, that's a tricky one. Working outside of the house. Okay, so obviously there is going to be increased risk compared to staying at home of contracting COVID-19. And so if your employer does give the option to work from home, I think it would be a good idea to take it if you can. But if your employer or the nature of your work means that you have to go on site, then if your employer is providing the appropriate public health measures, there's not really that much you can do to force them to keep you at home, aside from just maybe like a compassionate conversation and see if they would allow it. So you can look at kind of the public health and public safety websites to see if your employer is providing all things that you're supposed to have. In general, it's the same as anything if you're going out into public. So is everyone wearing masks when they're indoors? Is there social distancing or physical distancing occurring within the workplace? Are people encouraged to stay home when sick? And if you notice that those things are actually not happening, you can speak to your employer. You can file a complaint, and that's for the safety and betterment of everyone who works there. But if they're providing everything, then you're optimizing your safety, right? So you're doing the best thing you can. And so, if there's no other option, then you have to go to work, I guess.
Right. Again, it's probably a good conversation to have with the doctor, right?
Mm-hmm. Yeah.
If there's one message in all of this, I think these are not black and white kind of decisions sometimes. So it's, having those conversations and sort of weighing out different risks and stuff. As the holidays are approaching, some parents have other siblings, for example, who live somewhere else and really want to come home for the holidays and be with their loved one with a disability. I don't know, what are your thoughts about kind of what's safe or what makes sense right now?
I think it's really important to follow the guidance of your local public health department, right? So in some areas of Canada, the rates of COVID have gotten really high, and they're advising against, for example, traveling during the holidays, advising against large gatherings, like even family gatherings. However, they do have some rules that allow for like a single person to join a household, but it would be important, of course, for that person to be isolated for a couple weeks at least before they come to join you. Overall, it could be a risky thing, and if you don't know the rules, check for your provincial public health website to see what they're suggesting.
Right. And what about with, it's hard for a lot of families to do all the caregiving themselves sometimes. So there's different workers who are supporting families. What is safe for a worker to do with, now that there's more COVID cases and that kind of thing? What do you think is safe for workers? Can someone with a developmental disability go in the car with a worker? What kind of activities can they do together?
So in general, the safest place to be to avoid COVID-19 transmission is outdoors. But that can get difficult in this weather as the winter is approaching. We also have some guidance saying that any place that has good ventilation is better. So if you can manage to keep a window open, or if you're in the car, a window could be open, that could also help. Of course, the use of masks and face shields are really helpful, especially when there's going to be some close contact between the caregiver and the person with a disability. And good hand hygiene, all the normal stuff that we're expecting. But I think a lot of my patients have tried to make the decision to cut back on their amount of caregivers or amount of people that come into the home to help. And I don't know, I feel like it's not always the best choice for the family. You kind of have to weigh the pros and cons of it, right? Like it would be actually worse for some of my patients to not have that extra care or that extra time with someone, and the caregiving needs just become too much, right? So I've been trying to have that conversation with people about what's the right way to go about it.
Yeah, I think again, this idea of using your doctor as someone who knows you and your loved one really well, and just trying to think through those things, how you can reduce risk, how you balance things out. I mean, I agree, as a mental health person, you know, I get really concerned about families who are just kind of maxed out and can't manage, and there's no one else to help, because then someone's going to have to help anyways, right? So why not think about how you can get a little bit of help proactively that's as safe as possible?
Right. And you know, sometimes people say, well, okay, maybe I could find a balance in between, and instead of having 5 different caregivers, I'll have 1 or 2, for example, right? So it's just kind of figuring out how you can minimize risk while still keeping your family supported.
Yeah. Do you think it's important for people to keep seeing their doctors? I think some people are kind of like afraid to see their doctor because they're so busy and it's COVID and it's not a big issue. You know, there's kind of an avoidance of doctors right now.
For sure. It's interesting because it really does wax and wane. And I think it does have to do with kind of the prevalence of COVID or how much it's in the news. But I have a lot of patients who I do a lot of telephone medicine, and I'll call and say, okay, I think actually you should come into the clinic, and we have to have like kind of a big fight about whether they're going to come in or not. At our office, we're working really hard to try to minimize the amount of traffic in the office. So how many patients are coming in, really careful about cleaning in between patients and trying to keep distance in between patients. And so I think a lot of offices have had to make these types of changes. And if you're ever not sure, you can ask them, you know, will we be expecting to see lots of people in the waiting room? You know, how do we know if, will you be wearing like a mask, and should we be wearing a mask, and that sort of thing. At our office, when we are expecting people to come in, we have a kind of a thing that we ask all the questions about whether you have any symptoms, and then explain about the use of masks and stuff like that. So I think it helps build confidence that we're trying to make a safe environment.
Yeah, and then like you say, if it's not safe or it's not needed, there's still that phone call or that video visit as well, right? But kind of keeping in touch is really important, I think. The last set of questions I have are going in the positive direction questions, and they're about vaccines. I mean, I just heard this morning that Health Canada's approved the Pfizer vaccine, so we should be seeing people getting that really soon. But it comes with a lot of questions. You know, how do I know if it's safe for my loved one? What are the side effects? You know, if my loved one has allergies to certain things, do I need to be worried? Like, families are really concerned about the vaccine. So what can you say about that?
I do know that public health has lots of plans to provide education and information for people as the approval process is now finished, right? So they're going to have to start sharing information with the public. I do have a lot of confidence in the the process of creating vaccines. And so it's not just a simple, like, I designed this and let's try it out on people in the public. It has been several months of study on real people to see what happens when they receive the vaccine. So once they release some of that information for us to review, I think it's good for everyone to take a look and, or, you know, depending on how much information you kind of feel personally you need to know about. But looking at what happened when people took the vaccine. From what I understand, there, Pfizer and another one that's kind of up and coming, the Moderna vaccine, are quite similar. And it requires two doses, the Pfizer one. And so it seems like not too much complaints on the first dose, but some complaints of like pain and sometimes flu-like symptoms with the second dose. So we'll see what happens. And in the news today, actually, did you see they were also talking about in England, they did a mass vaccination yesterday for the Pfizer vaccine. So they were calling it V-Day. And they had a lot of like really exciting stories about people who been waiting for the vaccine. So yeah, it was really inspirational, kind of exciting.
Yeah, there's, I think, a lot of hope, I think, especially for people with developmental disabilities who've just been so isolated, aren't going anywhere right now, that with the vaccine, it will help them to be able to, you know, maybe get out of their house or connect a little bit with other people. There are questions, you know, I've been watching this really carefully. One of the questions that people had is, you know, what's the prioritization going to be like for people with developmental disabilities in Canada? Mm-hmm.
So there is a national body that has been doing a lot of work explaining outlining what they think should be the priority for the vaccine. And unfortunately, I don't see intellectual disability or developmental disability explicitly listed on that list, although your family member might qualify under something else. For example, there's a lot of emphasis on seniors, so people over a certain age, or people living in congregate living settings. So it is possible that kind of a priority access to the vaccine could still occur. But that's a kind of a national guidance document. Each province is going to make the rules about how they're going to distribute the vaccine. So we don't know necessarily exactly how each province is going to lay that out, but they will have to release that information. What do you think, Yona? I mean, it's kind of disappointing that intellectual disability is not on the list.
You know, of course, it upsets me. I think maybe one reason why it's not on the list is because the same reason why we haven't been studying it, right? So if we don't have any data in our country showing why it's a priority, if we don't think it's worth counting, then, you know, we're not going to put it right at the top of the list. It's interesting to look at movement, what's happening in other countries and how people are using the data. I know in the UK, it does appear on the list. They have a kind of hierarchy. You know, I don't think it's over yet here. I think they're just starting to make some of these decisions. And I think that's why it's really important for us to be sharing, you know, the research that's out, to be involved in research when it happens. You know, I think that we're going to be learning more and more. And, you know, there may be more recognition of increased risks of certain groups, which might include, you know, certainly some people with developmental disabilities, especially maybe older people or people who have other healthcare issues going on at the same time, other health complications. So maybe we'll see a bit more recognition, a bit of a shift. Yeah,
I think worrying about it, it depends on how much vaccine we receive and how fast we're able to distribute it. So, I mean, we might be worrying about something and then we get tons of vaccine shipments and it's a matter of a couple of weeks or a month of difference, right? So we don't necessarily know if it's worth panicking just yet.
No, I think that's a great point, right? I mean, I think if it takes a couple more weeks, that's not as concerning as if it's going to take 6 months more for one group than another. But I think, you know, continuing to educate ourselves, continuing to advocate, And also learning. I think, everyone's thinking about, well, am I going to get the vaccine? Will we be prioritized for vaccines? But we should also be asking, like, how do we explain vaccines? Right? So even like you said, the Public Health Agency of Canada is going to put out lots of information about vaccines and their process. Well, how easy to understand is that information going to be? And how do we explain it to our loved ones, right? And how do we explain what side effects to look for? And how do we give instructions on where to go? So not just like why you need a vaccine or what a vaccine is, but, if everyone has to register online, hopefully, I'm guessing families who are watching this video are savvy enough to figure out how to find the online video, right? But not everybody can register online. So, or not every vaccination site may be quite as accessible, right? So we do need to think about all those kinds of things, I think, in the rollout. And I hope we will. I think there's, I feel positive we're going to go in that direction, but it doesn't hurt, I think, to keep advocating.
Yeah, I agree. Yeah.
Yeah, I wonder, I've asked you lots of questions. Do you feel like there's anything? Actually, I do have another question. So we talked a lot about the effects of COVID, the effects of, vaccines. We talked about all kinds of things, but we didn't talk about mental health, and this is pretty stressful. So like one question I have from one family member is, long-term effects on mental health of COVID. My loved one reads so much. Can too much information about COVID be harmful?
So sometimes they call this, doom scrolling, like you're on the internet and you just keep reading all these terrible articles about pandemic and whatnot. Some people can handle a lot of negative information and some people can only handle a very little. And I think setting limits on how much you read in those areas is probably a good thing, right? So, you can have app limits, like if you're looking at it on your phone. That's something that I do because sometimes I can get really into reading too many newspaper articles, for example. So then I'll just say, okay, give me 10 minutes and that's it. Other people have hard limits saying we're not watching the news today. And I'll try to replace that with something else. Or even just the type of information that you're looking at. So instead of scrolling through many different random websites, say, maybe I'll check in once a day on this one news outlet or this one scientific area and read about that, and then that's it.
Right. Yeah, I think, again, this idea of also what's, the right outlets to look at, and we can put some links into some of those as well connected to the video, but also sort of ways to explain some of these things more easily, I think, for people with developmental disabilities is really important. And I don't know if all families and if all people with disabilities have access to that kind of information, so we can share that too.
There's some absolutely wonderful websites out there. So yeah.
All right. Well, thank you so much for answering some of these family questions. I hope it will be helpful to families, and it's always great to learn from you.
You know what? It was a pleasure. I hope it does help. I hope that people have a chance to kind of think about some of this stuff. And if they do have other questions, I'm happy to come back anytime.
We might do a part 2. All right. Have a great day.
All right.
Thanks.
See you later.
Bye.